Let me ask you something uncomfortable. If your doctor looked at you right now and said, based on your biology, here is the most statistically likely way your body will begin to fail after 60, would you want to know? Most people say yes, and then they spend the next decade ignoring the exact information that could prevent it. Here's what I find remarkable after years of working in preventive medicine. There is a single piece of data that every person in this country has had since birth. It sits on a card in a drawer somewhere, or on a hospital form from 30 years ago. And it is one of the most underused biological indicators we have for predicting age-related disease patterns. It is your blood type, not in the way diet books use it, not in the way wellness influencers talk about it, but in the way peer-reviewed epidemiological research, spanning hundreds of thousands of patients, tracked over multiple decades, has increasingly shown us that your ABO blood group leaves a measurable fingerprint on how your cardiovascular system ages, how your brain holds up under pressure, how your immune system behaves when it is under siege, and yes, statistically speaking, what is most likely to take you down if you do not intervene early. Today, we go through every blood type, O, A, B, and AB. And for each one, I'm going to tell you something most physicians never mention in a routine checkup. Not because they are keeping secrets, but because there is simply not enough time in a 15-minute appointment to connect these dots for you. I will do it right now. But stay with me through the end of this video, because there is a modifier that sits on top of every single blood type, something beyond the letter on your card, that changes your personal risk profile significantly. And most people have never thought about it once. But right now, before we go any further, do me a quick favor. Drop a comment below and tell me, what's your blood type, O, A, B, or AB? I'll be walking through each one in this video, and knowing yours is going to make what comes next much more relevant to you. Type O. Let's start with type O, and I want to frame this differently than you have probably heard before. Type O is the dominant blood type on Earth. Roughly 45% of people carry it, and for most of human history, that was likely an enormous survival advantage. Type O blood appears to have emerged in our earliest ancestral populations, shaped by environments that demanded physical endurance, a robust immune response to parasitic infection, and a digestive system capable of processing large amounts of animal protein under stress. Here is what that ancient blueprint looks like inside a modern body after 60. On the cardiovascular side, type O individuals tend to carry lower circulating levels of von Willebrand factor, a protein involved in clotting. Less clotting activity translates into smoother blood flow, less platelet aggregation, and a statistically lower risk of the arterial blockages that cause heart attacks and ischemic strokes. Multiple large-scale studies have confirmed that type O individuals carry a meaningfully lower risk of coronary artery disease compared to AB and AB combined. That is the good news, and it is genuinely good news. But here is what nobody tells type O men and women over 50. That cardiovascular advantage can become a psychological trap. I have seen this pattern more times than I can count. A type O patient in their late 50s comes in. Blood pressure is fine. Cholesterol is manageable. No family history of heart disease. And because they feel structurally protected, they stop paying attention to the systems that are quietly eroding. They ignore fatigue. They dismiss digestive complaints. They push through joint pain. Because type O's most serious age-related vulnerabilities do not come from the heart. They come from below it. The stomach lining of a type O individual expresses surface receptors that the bacterium Helicobacter pylori finds, quite frankly, easier to attach to than any other blood type. H. pylori is not dramatic. It does not announce itself with intense pain in most people. It moves in silently, colonizes the gastric mucosa, and over years and decades, it gradually breaks down the protective lining of the stomach. Left undetected, this creates a slow escalation from chronic gastritis to peptic ulcers to, in a meaningful percentage of cases, gastric cancer. And gastric cancer caught late is one of the more difficult cancers to treat successfully. There is something else. Type O individuals show a measurably elevated risk for certain peptic ulcer complications that require surgical intervention compared to other blood types. This is documented. It is not theory. So if you are type O and you are over 55 and you have never been tested for H. pylori, that is the single most important conversation to have with your doctor this year. It is a simple stool antigen test or a breath test. It is inexpensive. And for type O individuals, it is not routine caution. It is targeted prevention based on your specific biology. Here is your type O protocol for longevity. Your gut is your primary vulnerability. Protect it actively and consistently. That means limiting long-term use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin unless medically necessary. These drugs erode gastric lining in everyone. In type O individuals, they land on tissue that is already operating at higher biological risk. Incorporate fermented foods into your regular eating pattern. Kefir, miso, kimchi, naturally fermented pickles. These are not trendy extras. For type O, they are a practical tool for maintaining a gastric environment that is more resistant to bacterial colonization. And physically, your body was built for movement. Type O blood is associated with higher baseline catecholamine activity, meaning your nervous system runs on more dopamine and norepinephrine than other blood types. When that energy has no physical outlet, it converts into restlessness, disrupted sleep, and over time, cortisol dysregulation. 30 minutes of daily walking and 2 sessions of resistance training per week will do more for your long-term metabolic health than any supplement stack. Type O. Cardiovascular strength is your inheritance. Your stomach is your responsibility. Do not let the first make you complacent about the second. Before we continue, tell me your name and where you're watching from. I read every comment and I'd love to know who I'm helping today. Type A, type A. And I want you to lean in here because this is the blood type where the gap between what people know and what they should know is the widest. Type A emerged as human populations transitioned toward agricultural living. Denser settlements, more complex social environments, exposure to a broader range of infectious agents. The immune system adapted. Type A individuals mount aggressive and effective immune responses, particularly against viral pathogens. In younger years, that is a genuine biological asset, but this is where the blood type story gets complicated. Because what protects you in your 30s and 40s begins to work against you in different ways by your 60s. Type A blood carries higher coagulation activity. The platelets are stickier. The clotting proteins are more active. The landmark Harvard study tracking 89,500 adults over 20 years found that type A individuals carry a 5% elevated risk of coronary heart disease compared to type O. That number sounds modest in isolation, but here is what makes it clinically significant for type A specifically. When you layer chronically elevated cortisol on top of that stickier platelet activity, the compounding effect over decades is what turns a 5% statistical difference into a real cardiovascular event. The risk is not just in the number, it is in what your stress biology does to that number every single day. Now here is the layer that most discussions miss entirely. The reason that risk is so significant is not just mechanical, it is hormonal. Type A individuals maintain the highest baseline cortisol levels of any blood type. Cortisol is your primary stress hormone, and in short bursts it is useful. It sharpens focus, mobilizes glucose, prepares the body to handle a challenge. But when cortisol runs chronically elevated week after week, month after month, it does something very specific to your arterial health. It inflames and stiffens the endothelium, the thin inner lining of your blood vessels. And here is the mechanism that should concern every type A man or woman watching this. When your endothelium is inflamed and less elastic, it becomes a surface that sticky platelets preferentially adhere to. The elevated coagulation activity of type A blood and the chronic cortisol-driven endothelial inflammation of type A physiology are not two separate risk factors. They are a compounding cycle. Each one makes the other more dangerous. What this means practically is that for type A individuals, stress management is not a wellness preference. It is direct cardiovascular medicine. It belongs in the same category as blood pressure medication and cholesterol management because physiologically it is addressing the same underlying pathway. If you are type A and over 55, your blood pressure readings every 6 months rather than annually are not overcaution. They are appropriate clinical monitoring for your specific biology. Ask your doctor to include homocysteine in your next blood panel. Homocysteine is an amino acid that, when elevated, actively damages arterial walls. Type A individuals trend toward higher homocysteine levels, and the intervention is remarkably simple. Adequate folate, B12, and B6 found in dark leafy greens, eggs, legumes, and lean proteins. This is not expensive or complicated, but it is specific to you. And build a daily cortisol reset practice, not a weekend retreat, not an occasional meditation session, something you do every single morning before the day gets its hands on you. Diaphragmatic breathing, 4 seconds in and 6 seconds out, practiced for 10 minutes consistently, has measurable effects on cortisol regulation in clinical studies. The consistency matters far more than the duration. 5 minutes every morning outperforms an hour on Sunday by a significant margin. Type A, powerful immune resilience. Elevated cardiovascular risk driven by a stress hormone that your blood type keeps chronically elevated. Managing that hormone is the most important health decision you will make this decade. If you're still here with me and finding this helpful, take a moment to type A in the comments. It lets me know you're watching and getting value from this. Type B, the blood type that conventional medicine understands the least and mainstream wellness culture handles the worst. Type B emerged among nomadic populations moving across the vast interior of Central Asia and the Himalayas. These were people constantly adapting to new food environments, new climates, new infectious pressures. The immune system that developed is genuinely remarkable in its metabolic flexibility. Type B individuals can efficiently process a wide variety of proteins, fats, and carbohydrates without the inflammatory friction that other blood types sometimes produce in response to dietary variation. That adaptability is real, and in the context of how we evolved, it was a profound advantage. But here is the clinical problem that most type B individuals over 55 are carrying around without knowing it. Type B carries a distinct and not yet fully understood immune signaling profile. What the research does consistently show is that type B individuals appear to have a broadly adaptive immune response, one that processes a wide variety of dietary and environmental inputs differently than other blood types. Studies confirm that type B individuals have a measurably different gut microbiome composition, and that certain inflammatory dietary triggers, refined seed oils, ultra-processed foods, high fructose corn syrup, appear to generate stronger systemic inflammatory responses in type B compared to other blood types. The autoimmune picture across blood types is still being actively studied, and the findings are complex. What is clear is that keeping your inflammatory baseline low through diet, movement, and regular CRP monitoring is the most evidence-backed protocol for type B longevity. If you are type B and have been managing these kinds of symptoms with lifestyle adjustments alone, dismissing them as just getting older, it is worth a direct conversation with your physician about autoimmune screening. Early detection of autoimmune conditions changes the treatment trajectory dramatically. There is a second issue specific to modern life for type B individuals. The modern food supply is effectively a calibration problem for your immune system. Refined seed oils, ultra-processed foods, high fructose corn syrup, these do not just represent empty nutrition. For type B individuals, research points to these inputs as particularly potent triggers of systemic low-grade inflammation, the kind that runs below the surface for years and progressively distorts immune precision. Your C-reactive protein level, a standard inflammatory marker available on a routine blood panel, should be monitored at least annually. A consistent CRP reading above 1 milligram per liter without an obvious acute infection is a meaningful signal. It means your immune system is running in a chronically activated state, and you need to find the trigger before it finds you. For exercise, type B physiology responds best to sustained moderate intensity movement rather than repeated high intensity bursts. Cycling, swimming, hiking, and consistent walking protect your inflammatory baseline far better than interval training regimens that generate sharp spikes in inflammatory markers during recovery. Type B, the most metabolically adaptable blood type on the planet. Keep your immune system precisely calibrated, and it is one of your greatest assets. Let it run unchecked, and it becomes one of your most serious vulnerabilities. Before I move on to the next section, if this is helping you connect the dots about how your body might be responding to what you eat and how you live, do me a small favor and hit the like button. It helps this kind of practical, research-based information reach more people who are quietly dealing with fatigue, inflammation, or health issues they can't fully explain. And tell me in the comments, have you ever been told you might have an autoimmune issue, or has it always been explained as just normal aging? I read every comment, and I'm really curious how often this gets missed or overlooked. Type AB. Type AB is the youngest blood type in human history. It appeared relatively recently in evolutionary time, when populations carrying type A and type B antigens began mixing at scale. And because of that dual inheritance, it carries a genuinely unusual immunological profile. On one side, type AB inherited the immune tolerance tendencies of both parent types. AB individuals show lower inflammatory responses to certain environmental antigens, which translates into meaningfully reduced risk of some gastrointestinal cancers and certain gastric pathologies compared to other blood types. But here is where I need you to pay close attention, because what type AB gained in immune tolerance, it carries a cost in neurological vulnerability that the research has made increasingly difficult to ignore. Type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to type O individuals. The mechanism is cerebrovascular. Type AB blood carries elevated coagulation factors inherited from its A component, combined with the cardiovascular complexity of the AB antigen profile. Over decades, this creates subtle but cumulative changes in blood flow through the brain's smallest capillaries, the microvessels that service the regions most responsible for memory consolidation, processing speed, and executive function. These are not dramatic blockages. They are microscopic, gradual changes in perfusion efficiency across neural tissue that most people would never notice until the cumulative effect has been building for 15 or 20 years. This is the reason that for type AB individuals, cardiovascular health and brain health are not two separate conversations. They are identical. Blood pressure control, blood glucose management, cholesterol and triglyceride monitoring, every intervention that protects your arterial health is simultaneously protecting your cognitive longevity. DHA, the long-chain omega-3 fatty acid found in fatty fish like salmon, sardines, and mackerel, is incorporated directly into the cell membranes of neurons. It maintains membrane fluidity and reduces the neuroinflammatory signaling that accelerates small vessel disease. 2 servings of fatty fish per week or a high-quality fish oil supplement discussed with your doctor is not optional supplementation for type AB individuals. It is targeted neuroprotection based on your specific biology. Sleep is the other non-negotiable. During deep sleep, your brain's glymphatic system, its internal waste clearance network, flushes out accumulated metabolic byproducts, including the amyloid proteins associated with neurodegeneration. Consistently sleeping under 6 hours meaningfully impairs this process. For type AB individuals, chronic sleep restriction is not just fatigue. It is accelerating the very biological process your blood type already makes you more vulnerable to, 7 to 8 hours every night. This is your most powerful daily intervention, type AB. Impressive immune tolerance, a brain that requires deliberate, consistent, long-term defense beginning now, not at 70. If you're still with me and this is making sense so far, just type "it helped" in the comments. I genuinely read them and it helps me understand what's landing with you. The RH factor, before we close, there is one more variable that almost nobody includes in these conversations, and it matters. That plus or minus at the end of your blood type designation, RH positive or RH negative. Roughly 85% of people are RH positive, meaning they carry the RH antigen on the surface of their red blood cells. The remaining 15% are Rh negative, and this difference is not cosmetically minor. Rh negative individuals appear to carry a modestly different cytokine signaling profile, meaning the chemical language your immune system uses to communicate is calibrated differently. Research is still establishing the full clinical significance of this, but what is emerging suggests that Rh negative individuals may have heightened sensitivity to certain inflammatory triggers, which means, regardless of your primary blood type letter, if you are Rh negative and manage any chronic inflammatory condition, the anti-inflammatory protocols I have outlined today are even more relevant and should be implemented more rigorously. For women who are Rh negative, if you are pregnant or planning to become pregnant and your partner or baby may be Rh positive, this is a medically critical conversation to have with your obstetrician immediately. Rh incompatibility during pregnancy is manageable with appropriate medical intervention. It requires that intervention, and it requires it proactively. Know your complete blood type, the letter and the sign. Make sure your physician has both on record. Now here's the most important thing I am going to say today. And it is the thing that most blood type content completely avoids. The statistics are real. The risk elevations are documented. The biological mechanisms are genuinely significant. And they are not your destiny. I have watched type AB patients in their mid-70s with sharper cognitive function than colleagues 15 years younger. Not because their genetic risk profile was somehow different, because they understood what their biology was working against and they built their daily lives around addressing it. They slept 8 hours, they ate 2 servings of fatty fish every week. They maintained their blood pressure below 120/80 consistently, not just when they remembered. They kept learning genuinely new and challenging things, not casual scrolling, but real cognitive engagement. Their risk was still present. The statistical profile still applied to them. They simply chose to meet it directly rather than let it accumulate quietly in the background. The gap between genetic predisposition and actual health outcome is not small. It is enormous, and it is filled entirely by choices made consistently over years. That gap is where your decisions live. Your blood type is not a sentence, it is a map. And a map is only useful if you are willing to look at it. Now tell me something. What is your blood type, and does the profile I described today match what you have actually been experiencing in your own health over the past few years? Drop it in the comments. I read every single one, and what comes up consistently in this community shapes the topics I cover next. If you found this useful, there is another video linked in the description where I go through the 3 most commonly missed root causes of persistent fatigue and high blood pressure in men and women over 55, conditions that are addressable when caught early and almost always mismanaged when they are not. Take good care of yourself. You have carried this body a long time. It is worth understanding exactly how